We appreciate you staying up with us tonight. Next week's opening of the Olympics in Brazil has shined another bright light when it comes to the Zika virus. Researchers say even though that country has been hit hard by Zika, the likelihood of it spreading from Rio is minimal.
News 3's Whitney Miller spoke with local health officials today about the risk, or what the risk looks like for the residents of the Brazos Valley, and she joins us now. Hey, Whitney.
Hey, Steve. Hey, Carla. Well, in Texas so far, there have been around 70 travel-related cases of the virus, but locally there has been no transmission. That's part of the reason why health officials say we don't have much to worry about when it comes to a widespread epidemic after the Rio Games.
There's not going to be a greater risk. There's just going to be a larger crowd.
As thousands prepare to travel from around the globe to Brazil next week for the 2016 Olympics, many are concerned about their risk of contracting the Zika virus from mosquitoes in Rio. Brazos County environmental health specialist Kurt Johnson says even though there will be more people in a place where Zika is present, the risk of spreading the virus in the U.S. is minimal because of tourist accommodations.
If they're there for the Olympics, they're going to be attending events at venues that are going to be treated with insecticides. So they're not going to be facing the same risk as someone who is a resident of Brazil.
Johnson believes travelers will more than likely stay in air-conditioned hotels and says they should take a number of precautions like applying DEET, staying indoors, and checking with the CDC.
There's guidelines on how to dress, when to be active, maybe when to be outdoors.
And even though health agencies are reporting more than 1,400 cases over the past 6 months in the United States, Johnson says there have been no confirmed mosquito-borne transmissions in the U.S.
That speaks to the difference between people that are staying in an air-conditioned, screened environment who are taking the precautions.
Now, if someone does come back with flu-like symptoms from a Zika active country and believes they're infected, Johnson says a doctor should be contacted and a blood test should be done. For now, live in the studio, Whitney Miller, News 3.
All right, Whitney, thank you very much.